Are you somebody who's suffering from elbow pain, degenerated joints and broken bones? Your body's own healing cells, tennis elbow or lateral epicondylitis. When tennis players used to have a single backhand extending our wrist, ECRL, and ECRB, PRP or platelet-rich plasma, which are healing cells taken from your own body, exercises, activity modification and some anti-inflammatory medication. Hi guys, welcome back. Are you somebody who's suffering from elbow pain, especially on the outer aspect, and you've been thinking it is tennis elbow and you've been wondering how to go about treating it? If so, then you have come to the right place. I am Dr. Santhosh Jacob, orthopedic surgeon and regenerative medicine specialist from the city of Chennai, Tamil Nadu, India. Generally, most of my work is to fix degenerated joints and broken bones. But regenerative orthopedics is a subspecialty of orthopedics where we use your body's own healing cells to treat and rejuvenate injuries in your ligaments, your bones, your cartilages, muscles and tendons. And today I am going to talk about tennis elbow or lateral epicondylitis. I believe that information about a disease is the first thing you do when you start conquering a disease, and I am here to help you with just that. So if you liked what you saw, then please consider subscribing and also press the notification button so that you can get such regular updates. Now let's get to tennis elbow. Tennis elbow is a painful condition which occurs in the outer aspect of your elbow. What happens is you're unable to push or pull using your elbow, or you're unable to take things, heavy things like a laptop outside your bag, or even move a kettle. And the pain is most often concentrated on this tip. If it is so, then you probably have tennis elbow or lateral epicondylitis or losis. Now let me explain the term lateral epicondylitis. Lateral means outside, epicondyle is the tip of the bone, and itis means inflammation. Tennis elbow basically means inflammation of the muscles which insert on to the tip of your outer aspect of the elbow. The reason why the name tennis elbow came into the picture is when tennis players used to have a single backhand, do you remember? And at that point of time, if they struck the ball with a loose grip, then the muscles which inserted onto the outer aspect of our elbow underwent some kind of trauma and it started to hurt. So even though it was associated with tennis players who had a single backhand, it is not only a disease which occurs in tennis players is what you need to know. It can happen in anybody who has a weak extensor muscle region. We have two muscles which help extending our wrist. Now this action is called extending. These two muscles are ECRL or extensor carpi radialis longus and ECRB or extensor carpi radialis brevis. And you have to note that the ECRB is the one which gets injured more often in the elbow. So either it can happen over a period of time like a repetitive stress injury which causes just inflammatory changes, or it could happen because of a single event. It could be a sports injury, or it could be you trying to lift something heavy, and it could cause a tear in the ECRB or the ECRL, precipitating a condition called tennis elbow or lateral epicondylitis. How to diagnose at home if you have tennis elbow or not? I'm going to give you a test. Now first put your hand like this and identify the outermost bony point of your elbow and press on that region. If your pain increases when you press the soft tissue against your bone, you probably have tennis elbow. And to confirm it, move your wrist in the upward direction, and if your pain increases more often than not, you have tennis elbow and it's time for you to go and see your orthopedic surgeon. As I explained earlier, most of your clinical symptoms will be pain in the elbow, stiffness in the forearm and difficulty to do actions which involving moving your wrist up, especially using weights. And sometimes even shaking of hands could trigger off pain in the region. If this is happening to you, you could have tennis elbow, so please check it out. On examination though, the elbow looks more or less normal. If it has been there for a long period of time, you might have some swelling. Now, apart from a clinical test, how will your doctor diagnose it? Generally, there are no investigations or scans to diagnose an initial case. But if you're having continuous issues of tennis elbow, then definitely an MRI scan will help us showing a tear or edema or an injury in the bone in your elbow. How will your doctor go about treating you if he diagnoses that you have tennis elbow? There are a few things you can do first. Always the RICE regimen. Rest your elbow. Ice it. Whenever you have time, ice it. Compress it. Apply a compression bandage, generally in the region of your upper forearm, and it helps. And E stands for elevation. So when you're sitting or resting, try to elevate your elbow above the level of your heart so that the edema, if there is any swelling in the region, it reduces. Apart from that, we can give steroids into your joint, even though I do not advocate it too much, because I use PRP or platelet-rich plasma, which are healing cells taken from your own body and which do not have any side effects. They have very similar effects to steroids without the side effects, and they can be harvested very easily from your body at the doctor's office. Injection of those into the elbow, the PRP, reduces inflammation biologically and helps healing of the tissue. If you're being continuously treated with physiotherapy, activity modification, that is, you're stopping the activities which are triggering the pain, but still your pain is continuing, it is called as recurrent tennis elbow, and you might need a minimal access surgery where I move out the insertion of the tendons from the elbow in such a way that there is no stress on the tendons, and this relieves your tennis elbow pain. But if you go early to the doctor and you do your self-diagnosis with the test, you will definitely not need the surgery. Exercises, activity modification, and some anti-inflammatory medications will be enough. So this is it, guys, about tennis elbow. If you have any doubts, or if you're someone who has had tennis elbow in the past, just tell me how you got it treated and we will have a discussion about it. All right, guys, see you. Bye-bye. Dr. Santhosh signing off.